Pacemaker. Introduction. The electrical signal that results in a heartbeat starts in an area in the right atrium.
Select true or false.
Correct. The electrical signal that produces a heartbeat starts in an area of the right atrium called the sinus node. The electrical impulse of a heartbeat starts in the sinus node and travels through the AV node to the ventricles.
Select true or false.
Correct. From the sinus node, electrical impulses go through fibers that are like electric cables to the AV node. From there, the electric signals spread to the ventricles, causing the heart to contract and pump blood. An arrhythmia is an abnormal heartbeat.
Select true or false.
Correct. An arrhythmia is an abnormal heartbeat. There are different types of arrhythmias. The battery of the pacemaker is in the insulated leads.
Select true or false.
Correct. The battery is sealed in the metal shell of the pulse generator. You will be asked not to eat or drink for several hours before the procedure.
Select true or false.
Correct. If your surgery is in the morning, this usually means no food or drink after midnight the night before. During a pacemaker surgical procedure, the patient is asleep.
Select true or false.
Correct. Pacemaker surgery is done under local anesthesia, which means only the surrounding skin area is numbed. The risk of infection is common for pacemaker surgery.
Select true or false.
Correct. Infection is pretty rare during and after pacemaker surgery. However, infections can still happen. Rigorous movements of the arm on the same side of the pacemaker should be avoided for a few weeks after surgery because the leads could come loose.
Select true or false.
Correct. The battery of a pacemaker will last forever.
Select true or false.